Welcome back, guys. Today's video is about common misconceptions about psychology. In today's video, we'll explain common misconceptions people often have about psychology, and we'll make them clear for you in a digestible way. Before we get to it, this is Easy Psychology, 101 channel, and I'm a psychologist whose goal is to make psychology easier for you and help you if you have any questions or inquiries. So feel free to contact me anytime if you need any help. Now let's get to today's topic. Here are some common misconceptions about psychology, presented in a digestible way. 1. Psychology is just common sense, but in reality, while some psychological concepts may seem like common sense, psychology is a scientific discipline based on rigorous research and evidence. Many findings in psychology actually challenge our intuitive beliefs. 2. Psychologists can read minds, but in reality, psychologists can't read minds. They use observation, assessments, and interviews to understand behavior, thoughts, and emotions. It's more about understanding patterns than knowing specific thoughts. 3. Therapy is only for people with serious mental illness. But in reality, therapy is beneficial for anyone, not just those with severe mental health issues. It can help with stress, relationship problems, personal growth, and everyday life challenges. 4. Psychology is only about mental illness. But in reality, psychology covers a broad range of topics, including emotions, cognition, development, personality, relationships, and even workplace behavior. It's not just about diagnosing and treating mental illnesses. 5. All psychologists are the same, but in reality, psychologists specialize in different areas. Some focus on therapy, such as clinical psychologists, others on research or teaching, or even organizational behavior. The field is diverse, with many specializations. 6. Medication is better than therapy. But in reality, medication can be helpful for some, but it's not always the best or only option. Therapy has been shown to be effective for many issues, and sometimes a combination of both is the most beneficial. 7. You can solve all your problems with positive thinking. But in reality, while a positive mindset can help, it's not a cure-all. Addressing deep-seated issues often requires more than just positive thinking, such as therapy or lifestyle changes. 8. Psychology is an easy subject, but in reality, psychology involves understanding complex theories, conducting research, and applying knowledge in practical ways. It's a challenging and intellectually demanding field. These points can help clear up some of the common misunderstandings about psychology and present the field in a more accurate light. 9. Introversion is the same as shyness, but in reality, introversion and shyness are different. Introverts may prefer solitude and quiet environments, but are not necessarily shy. Shyness involves fear or anxiety in social situations, which isn't a hallmark of introversion. 10. Stress is always bad for you, but in reality, not all stress is harmful. Some stress, known as eustress, can be motivating and help individuals perform better in challenging situations. Chronic stress, however, can have negative effects on health. 11. You need to have a problem to see a psychologist. But in reality, many people visit psychologists for self-improvement, relationship advice, career guidance, or to develop coping strategies before problems arise. Psychology isn't only about fixing issues, it's also about personal growth. 12. IQ tests measure all kinds of intelligence. But in reality, IQ tests primarily measure specific cognitive abilities, such as logical reasoning, problem-solving, and memory. They don't capture other forms of intelligence, like emotional, social, or creative intelligence. 13. Psychologists have all the answers. But in reality, psychologists help guide clients toward their own insights and solutions. Therapy is often a collaborative process, and there isn't always a clear-cut answer to every problem. 14. Mental health can be fixed overnight. But in reality, psychological healing and change take time. While some may experience quick relief, however, lasting change often requires ongoing effort and dedication. 15. You can't be happy and have a mental health issue. But in reality, it's possible to experience moments of happiness and fulfillment even if you're dealing with a mental health condition. Mental health is a spectrum, and people can have good days and bad days. And luckily, we've reached a point where all mental illnesses can be manageable, and patients can have almost a normal life. I hope I made them easier for you guys. And if you have any questions or inquiries, remember I'm here to help you. So if you like the video, please like it and subscribe to the channel, because that helps me to keep going. See you soon.